So I just want to start with some facts. The first one is during the previous 6 months, what percentage of registered nurses admitted to being bullied in the workplace? What might you think that would be? You might be surprised. The answer is actually 48%. So if we just round that up to 50%, in this study, which was a large study, almost 50% of nurses admitted to being bullied in the workplace. That's the people that actually say they were bullied. What we do know is that there are many nurses that will not even talk about it, will not even admit to it. They're ashamed of it. So this statistic is probably even much higher. And who wants to go to work every day where the chances of you being bullied are great? And how is that going to impact the work that you do and the care of your patients? The next one is, and there may be lots of people in the audience who work in all different areas. What we're talking about today is for nurses and physicians, housekeeping, laboratory services, physical therapy. But the example I'm going to use today, or this fact is, especially if you work in the operating room, is what percentage of perioperative personnel reported loss of concentration, reduced communication, collaboration, and impaired relationships with other team members as a result of disruptive behaviors. You may be surprised to find that it's 80%. So what does that say? No matter where you work, if you go to work and you are stressed out or on your way to work, I drive almost 1 hour to work every day, and that can set the tone for your day. Traffic, if you're listening to the news and it's all bad news, you can be very distracted. And in some jobs, there might not be a big consequence in being distracted. But for us as healthcare workers, we're going in and other people's lives depend on how we react, what's going on in our day. So for 80% of us to admit that these disruptive behaviors affect our communication and collaboration with other team members is extremely alarming. And the last question is, how many people die each year from preventable healthcare errors? The key in this question is preventable, meaning this did not have to happen. There was something that could have been done to prevent these errors. And this number is startling. It is 250,000 people, or 250,000 people die from preventable healthcare errors every year in our hospitals in this country. That should all give us pause when we think about creating these healthy work environments. If you look to the far right in the blue, these are very safe activities or industries: scheduled commercial airline flights, European railroads, and nuclear power. Meaning, no matter how many times you fly, or even if you live by a nuclear power plant, which I do near Harrisburg, Pennsylvania, they're safe. The chances of you being hurt or dying in an accident when engaging in these activities is very, very slim. And I always like to remind myself of that because I don't like to fly. I'm getting a little bit better, and I think my fear of flying is quite irrational. But whenever I'm about to get on a plane to travel for anything, and especially with the Healthy Workforce Institute, I think I'm going to be okay because this is a really safe activity. But then we move towards the left. Driving in the United States, chartered flights, and chemical manufacturing. These are less safe industries or activities. And I remind myself of that also because where I live in South Central Pennsylvania, I am about 50 miles from Baltimore, Maryland. So I typically will fly out of BWI. And driving from York, PA to Baltimore on 95 in the Beltway is extremely dangerous. And so I remind myself that the chances of me being hurt in a car accident, or even worse, is much more likely than dying in a car crash. So again, it gives me some comfort. And then we go to the far left in the red, and we talk about mountaineering and bungee jumping. You may not know this, but these are really unsafe activities. The only time I had an audience actually raise their hands, like a majority of people that said they had participated in these activities, was when a couple summers ago, I was in Santa Monica, California. And so you found a lot of people that enjoyed these type of outdoor activities, but they're dangerous. And even if you're a weekend warrior and do this every weekend, the chances of something bad happening or even dying is pretty high. But for me personally, and for my family, I don't worry about it too much because I have no intention, at least right now, of ever participating in these types of activities. So in terms of my safety and the safety of my family and friends, I'm not too worried about it. But then let's look at where healthcare falls. You have more of a chance of dying when you walk into any hospital in this country than you do of mountaineering or bungee jumping. And that goes back to the question I asked just before this slide about 250,000 people dying every year from preventable healthcare errors. That is the equivalent of a jumbo jet crashing every Monday, Tuesday, Wednesday, Thursday, 4 days a week. If that were happening in this country, we would be paying attention to it, wouldn't we? And 85% of these preventable errors are due to a lack of communication. And bullying and incivility in healthcare cause a lack of communication. And I don't know about any of you, as a leader or for my staff, I would not want to be responsible for the death of someone's mom or dad or grandma or grandbaby just because as healthcare workers, we don't know how to treat one another. When disruptive behaviors go unchecked, bad things happen to patients and their families. Our mission should be to create a world where bullying and incivility is automatically rejected and kindness, respect, and civility become the norm. The way we treat each other should be just as important as the care that we provide.